You might be wondering if you should get screened for sleep apnea. And if you are, you've come to the right place because we're going to cover reasons why you should get screened for sleep apnea, and specifically 8 reasons why. People with diabetes are actually at higher risk for sleep apnea, and it has something to do with the high blood sugars associated with diabetes that can lead to weight gain. And then those high blood sugars too can affect the nerves that are involved with controlling breathing. So let's get into reasons to get screened for sleep apnea. Reason number 1 is snoring. And by the way, what I'm going through as far as the reasons why, this is something that I use as a primary care doctor to screen my patients in the office for sleep apnea. Typically, if they come in complaining of some sleep-related issues or think they have sleep apnea, I'm going to have my medical assistant just kind of hand them this questionnaire to fill out, and I have it ready to review with my patient when I get into the room. So number 1 is snoring. And this is snoring like really loudly. You could still be snoring softly, but really loud snoring where people across the hall can hear you or your bed partner can't get any sleep at night. That's one of the common signs of sleep apnea and one of the complaints that people come in with. Number 2 is feeling tired all the time, especially daytime drowsiness or sleepiness. And there's been studies showing that people with sleep apnea, especially untreated sleep apnea, are at risk for car accidents because of being really sleepy during the day. That's number 2. And you can imagine that if you're not sleeping well at night because of sleep apnea, then you're going to be tired during the day. So we ask, do you have to take a nap during the day or feel like you need to take a nap during the day? Or are you waking up and you're not having restful sleep? That's another sign of sleep apnea. The next sign is observed apnea. So did somebody see you stop breathing? Or do you have like these choking and gaspings that wake you up at night? This doesn't happen just one time. This happens several times throughout the night. And it's something that is looked at when you're doing a sleep study, the test that's used to diagnose sleep apnea. They're looking at how many times you're having these apneic episodes during the night. That's the third reason to possibly get screened. The next reason is pressure. Do you have high blood pressure? Are you being treated for high blood pressure? High blood pressure is a risk factor for sleep apnea. And so that's another thing to think about. And is your blood pressure actually controlled? If it's uncontrolled, you're even at higher risk. But even some people with controlled blood pressure could be at risk for sleep apnea. The next sign of possible sleep apnea is body mass index. This is a body mass index greater than 35. This is considered obesity. So is your body mass index really high? Do you have obesity? That is a risk factor for sleep apnea, and it might be a reason to go get checked. Age is another risk factor for sleep apnea. If you are older, then if you're 50 years old or older, that increases the risk for sleep apnea, just being older. There are people younger than 50, obviously, who have it, but the older you are, especially over the age of 50, the higher your risk is for having sleep apnea. The next sign or symptom of sleep apnea is neck size. For guys, this is really simple. We'll just say, hey, what's your neck size? What size shirt do you wear? And if your shirt collar is 16 inches or larger, that increases your risk for sleep apnea. For women, we'll get out a tape measure and actually measure the neck circumference to see. And if it's larger, if it's 16 inches or larger, that increases the risk. And basically because you have to kind of breathe through your neck, through your throat. And if you've got lots of excess tissue there, that can cause some obstruction, especially when you're laying flat and the tissue falls backward. The last risk factor is gender. males are at higher risk for sleep apnea. So just being a man, being a male increases your risk for sleep apnea. The acronym for these signs and symptoms of sleep apnea is stop bang. So that's the questionnaire that I'll hand to people. It covers all the symptoms we just talked about. Snoring, feeling tired, that's the T. Observed apnea, so stopping breathing. Pressure, do you have high blood pressure? That's the stop. And then the bang is body mass index. And A is age, the N is neck size, and then the G is gender. That's the bang. So stop bang is the acronym that we use to think about this. And if you have just one or two of the signs or symptoms on this list, then you're probably lower risk for sleep apnea. We might look at other things that might be causing your symptoms. But if you've answered positively to 3 or 4 of these questions, then there's a moderate risk that you do indeed have sleep apnea. If you're answering 5 or more questions positively, there's a high risk that you do indeed have sleep apnea. And we diagnose this by doing a sleep study. That's one way, but now with more technology, we have these home like sleep monitor things that you can wear overnight that's going to check for how many apneic episodes you're having during the night. And we'll get those results and we can review it, and that'll let us know if you're having sleep apnea or not. And it's actually simpler to do than actually having to go into a sleep center where somebody's like monitoring you. There, you've got all these bells and whistles and things attached to you. And it's a wonder that anybody actually gets to sleep when they're in a sleep center doing a sleep study. But some people actually need to go to the sleep center. Like if you've got like respiratory issues that are severe, then somebody actually really needs to monitor you while you're sleeping. So hopefully now you've found out 8 reasons why you should get screened for sleep apnea. The more of the questions that you answer positively to and you have these symptoms, and the more likely it is that you should go get screened for sleep apnea.